Hi, my name's Jen McGlashan and I'm one of the directors at Fitwise Physio. We often get asked questions around various aches and pains during pregnancy, and one of them is often, what is pelvic girdle pain? Pelvic girdle pain is when you experience pain around your pelvic area. Generally, it's felt either at the front across your pubic bone or around the back, around the bottom of your spine. It can be on either side, down low. It feels like a bit like lower back pain, but it's quite low. And it can extend into your bum muscles or gluteal muscles, and it can extend down the back of your upper leg. You can experience pain at the front and at the back at the same time, and you can have it on both sides or just one side of your lower back. One of the things that we also get asked is, what are the warning signs? How can you tell if you're getting pelvic girdle pain or you have pelvic girdle pain? Often what you feel is pain during particular activities. So it may be rolling over in bed, you experience pain. It might be getting up out of a chair or off the couch. It may be while you're walking, or it may be after you've been walking or doing some kind of activity on your feet that later when you go to move, you feel really stiff and sore around the pelvic area. If you are experiencing these sorts of pains, then there are some simple things that you can try at home. One is to move carefully. So when you're going to move out of a chair or roll over in bed, if you sort of gently draw your tummy in, like you're just gently hugging your baby, and hold those muscles in as you change position, that might help with the pain. The other thing that you can try is, if you're getting quite achy and sore, ice packs work particularly well. So you can pop an ice pack across that lower part of your back, or you can, and I mean low, down around where your pelvis is, so the back of the pelvis area, or at the front across the pubic joint, where if you press in the middle at the front there over the bone, it'll feel quite tender. So you can pop an ice pack there, and you can pop an ice pack in both places at the same time, so around the back and around the front. The ice won't do any harm for your baby. We often get asked, won't the baby feel the cold? The ice only penetrates to a very narrow, like a few millimetres, but it is far enough to actually have a little bit of an effect around the area where you're feeling pain around the joints, and to make a difference to the way that your muscles are working and the way you're experiencing your pain. Other things that you can do are some stretches for your glute muscles. So if you sit on the edge of a chair and cross your legs a bit like a bloke, and then you can stretch those muscles to help ease some of the tightness that often we get in the muscles during this time. What can physiotherapy do for you if you have pelvic girdle pain? We can talk to you either in person or via telehealth, and we can troubleshoot for you all of the things that you're doing either at home or during your day, which at the moment during COVID is going to be at home. However, you have lots of setups at home of the way you do things, either for sitting at your desk, sitting on the couch, how you're lying in bed, how you're doing things in the kitchen. And we would be able to look at via the telehealth camera as to how you're doing those certain things, and give you advice on how you can do that setup better to enable you to be able to do them more comfortably at home. We can also teach you lots of exercises. We can teach you lots of stretches. We can ensure that you're doing those exercises and stretches correctly, and also give you information on how to self-treat your tight muscles. So things like self-massage with spiky balls, how to use that effectively, and how to self-treat in other ways so that you can be as comfortable as possible during your pregnancy. If we discover via telehealth that you are going to require a pelvic belt to help give you some support during your pregnancy and to help minimise your pain, then we will be able to work out what size you are and organise to send the right belt to you, and then instruct you on how to wear it so that you can be comfortable for the rest of your pregnancy. If you find that you want to actually come in person, our clinics are still open, and if you click on our website, you can see the extensive sanitation processes that we're going through to be safe environments for you to come into. And if you want to come in for a one-on-one treatment, you can do that. We have treatments with a physiotherapist. We're a very low volume clinic, so there's very few people coming through the clinic every day. And you can come in and have a one-on-one face-to-face consultation with the physio who can do some manual therapy for you and actually relieve some of the tightness in the muscles if you have not been successful with the home exercises and self-massage that we've taught you already.